Hi everyone, myself G.Prabu, MSc MPhil, lecturer, Department of Biochemistry, E.S College of Nursing. Now I discuss about the topic is jaundice. Jaundice is a condition. There is a yellow color changes in the skin, mucous membrane, nail due to excess secretion of bile in our blood. Introduction. When excessive amount of bile pigment is present in the blood, it escapes into the tissues, skin, mucous membrane, coloring them yellow. This condition caused by the overflow of bile is called jaundice. The normal level of bilirubin is 0.2 milligram percentage to 1 milligram percentage. If the level exceeds above 2 milligram percentage, there is some changes in the region of skin, mucous membrane, nails, face. Next, bile is secreted in the liver. Bile is an pigment. Next, we move to causes. It may occur due to following causes. Some causes is overtaking of alcohol consumption, drugs and other chemical agents also induce this jaundice. It may occur due to the following causes: excessive production of bile pigment beyond the capacity of normal liver to excrete it, obstruction in the normal excretory passage of bile in the liver or outside the liver before reaching the duodenum, dysfunction of liver cells resulting in failure to excrete the normal amount of bilirubin produced. Next, classifications of jaundice. First one, hemolytic jaundice. Second one, obstructive jaundice. Third one, toxic or hepatic jaundice. Hemolytic jaundice are otherwise known as prehepatic jaundice. Obstructive jaundice is otherwise known as post-hepatic jaundice. Toxic or hepatic jaundice. Next, hemolytic jaundice. Hemo means blood. There is some lysis in the blood is called hemolytic jaundice. It is also called prehepatic jaundice. It is caused due to increased destruction of erythrocytes followed by excessive hemolysis. This may follows. Hemolytic anemia, phenylhydrazine, carbon tetrachlorides. These are the agent to induce hemolytic jaundice. First one, hemolytic jaundice. Ingestion of drugs acting on liver cells, normally tetrachloride, phenylhydrazine, the latter being used in the treatment of polycythemia, malaria, viral infection, incompatible blood transfusions. The symptoms of jaundice are loss of appetite, fatigue, weakness, next vomiting, fever. These are all the symptoms of jaundice. General laboratory observation in hemolytic jaundice. The blood serum is yellow colored. Serum A, total bilirubin increased. Serum B, direct bilirubin normal. Serum C, indirect bilirubin increased. Urine A, freshly voided normal color. Urine B, unstanding dark due to formation of urobilin from increased urobilinogen. Stool. The patient's stool sometimes clay colored or grey colored. Dark due to formation of urobilin from increased urobilinogen. Next, hemoglobin. Reduction in hemoglobin concentration of blood. Next, we see obstructive jaundice. Obstruction. There is obstruction in the passage of flow of bile in gallbladder. It will be blocked in that region. So the jaundice will be come from that blockage. This occurs when there is obstruction in the passage of bile, preventing the flow of bile in the gallbladder in intestine. The usual causes of obstruction are due to blockage of the bile passage by a gallstone. Next, tumors, cancer cells, structure of or narrowing of bile duct caused as a result of surgery on the duodenum. The conjugated bilirubin, cold bilirubin, after leaving the liver may get blocked and where its passage to gallbladder and intestine. Failing to get excreted in the normal pathway, it regurgitates into the bloodstream after getting absorbed into hepatic veins and lymphatics. Next, hepatic jaundice. Hepatic jaundice is otherwise known as hepatocellular jaundice. This type of jaundice is caused by toxin hepatic virus. Other than hepatic virus, liver poisons like chloroform, phosphorus and carbon tetrachloride also cause this type of hepatic jaundice. Infective hepatitis is most familiar example of this variety. These agents produce inflammation and damage to the liver parenchyma cell, which in turn are unable to convert urobilinogen into bilirubin. Hence, the excess urobilinogen finds way in the general circulation and gets excreted in the urine. The serum concentration of unconjugated bilirubin is raised. What is meant by conjugated bilirubin? Conjugated bilirubin is otherwise known as direct bilirubin. This bilirubin is excreted in the urine from the liver. Unconjugated bilirubin is otherwise known as indirect bilirubin. It will not be excreted. It will be binds in albumin. It will be present in the region specifically liver. Other for conjugated bilirubin, it is soluble in water. Unconjugated bilirubin, it is insoluble in water. Next, we move to neonatal jaundice. Neonatal jaundice. Neo means new. This jaundice mainly occurs in newborn babies. This jaundice is serious in the time of severe in the time of childbirth. After it will be disappears in 1 or 2 weeks. Neonatal jaundice is a yellowish discoloration of white part of the eye and skin in newborn babies due to high bilirubin level. Symptoms include excess sleepiness or poor feeding, seizure, cerebral palsy. Next, diagnosis of jaundice. Slinger's test, Fauci's test, Gemelin test are the tests used to diagnose hemolytic jaundice, hepatic jaundice, obstructive jaundice. Okay. Thank you for all.